Good evening, everybody. Welcome to the PANSIGHT webinar. Let me start the slideshow. Today's topic, medicines kill millions. Why did I choose this topic? Medicines kill millions. There's a reason. More than 90% people, 90% people, including doctors, are not aware or ignorant about this fact. They are ignorant. That is one of the reasons many doctors prescribe medicines that kill people. Sheer ignorance as well as indifference. And I gave a talk, Dangerous Doctors, a few months back. Yes, these days, doctors, significant number, I'm not saying that all doctors, doctors, no, significant number of doctors, and especially those who are below the age of 40. Why below the age of 40? These doctors, they choose the medical profession not out of passion or compassion. They choose the profession out of motivation, make as much money as possible. And many of them, for their medical education, they spend MBBS 50 lakhs to 1 crore, MD another 1 to 2 crores. Lot of money, they are in debt. So they engage in unethical practice. They do many unnecessary procedures. Do you agree? If you agree, put A in the chat box. If you agree, put A in the chat box, because I am, thank you, Binduji. So I am sharing, okay, thank you, Roy Chanandi. I am sharing fact, authentic fact. Nobody can, I repeat, nobody can discredit this fact. Is 100% or 200% this is true. That is why I thought of giving a talk on this subject, that is, medicines kill millions. And a couple of my other friends, non-medical friends, that's exaggeration, alle. Millions? Maybe a few thousands. I told them, I am a person who doesn't exaggerate. Because exaggeration is a branch of lying. Exaggeration is a branch of lying. And integrity. I don't want to lose my credibility or integrity. So when I show you some facts and evidence, my dear friends, you will be convinced. That is my statement. That is, medicines kill millions is absolutely true. Definition of kill. Oh, because we may be wondering why is he giving a definition for kill? We know what kill means. No. Kill could mean destroy, ruin, or put an end to. Ruin means the damage. Person is not dead. Ruin the life. My own two close relatives. My own uncle, maternal uncle, and another person, my father's brother. One is my mother's brother. The other person, my father's brother. Both of them, their life was ruined by medicines. One person, Pethidine is a narcotic painkiller. For chest pain, he was given pethidine. And even for mild pain, again repeatedly given while he was in the hospital 3 or 4 times. He got addicted to that one. Okay. And subsequently, for the next 3 years, he became a pakka pethidine addict. And he stopped coming for work. And financial ruin. And eventually died from pethidine overdose. He ended up taking up to 20 or 25 ampules every day. Then my father's brother, paternal brother, he was given the wrong medicine. A medicine used for treating tuberculosis, TB, streptomycin antibiotic. Even without doing a chest X-ray, the doctor, it was a professor of medicine. He had cough for some 3 or 4 weeks and he was very lean. So the professor assumed, oh, thin person cough, okay. Streptomycin. After taking some 10 or 15 doses, one of the side effects of this medicine is damage to the vestibular nerve. And about the balance. He started developing vertigo, dizziness, unsteadiness, tendency to fall. And soon it became an irreversible damage. He was not able to leave his home because of the fear of falling. He went into severe depression. That is again ruined his whole life. He was completely homebound. Depression, under the care of psychiatrist. After some few years, he committed suicide. These 2 examples are real. Now, tell me, my dear friends, are you convinced that medicines kill people? If you are convinced, put C in the chat box. Are you convinced now? Okay, thank you. Thank you, Roy Chirianji, Ramendran. I lost, especially that paternal, that uncle. Very nice person. Always helpful. His death actually, even after now how many years? 45 years. I find it difficult to forget. That created a lot of trauma inside me. Medicine. Okay, why this guy is giving a definition for medicine? We know what medicine is. No, my dear friend. No. Medicine is a substance or preparation used for treating or preventing a disease. Vaccines. And especially the COVID vaccine. Without a proper anything, in a haste within 6 months, not much of study and all those things. The pharma, they are good at selling. And many drugs used for prevention again, they create a lot of harm. So that is what medicine means. I'll talk about things you don't know. Obviously, I already told you things you didn't know. And you might know, but you don't have a deep knowledge. Just a superficial, vague. Then you must know. You must know if you want to protect yourself from death or disability. I repeat, my paternal uncle, he was disabled. Disabled, he could not leave the home. It was as if that he was in a prison, solitary confinement inside his home. Before 1980, no TV, nothing. So boredom. Etra pain aayirikkum. Can you understand? If you can understand, put you in the chat box. The kind of suffering. So that is what it is. Okay, thank you. Roy MCG. I am a person, this one is, I am very compassionate. This one, my mother was very compassionate. Always used to help people in the neighborhood. Anybody falling sick, okay, she will go there, visit them, and help them in whatever way she could. So right from the childhood, as a young boy, I had the opportunity to witness, and that one actually made me more compassionate. My webinar is always based on FAQ facts. Experience, I already shared experience from my personal life and some experience from my professional life also I'll be sharing during the course of my presentation, then quotations. There are many books on the medicines, toxic medicines, deadly medicine, the medical pharmaceutical killing machine. Make your medicine safe. Okay, I'm going to share some facts. There are numerous, but for a want of time, we have to finish it before 9 o'clock. 1 million plus hospitalizations and 165,000 deaths every year linked to NSAIDs. Do you know what NSAIDs means? If you don't know, put N in the chat box. If you don't know what NSAIDs is, please put okay, Ramendran as NSAIDs. No. Okay. It's a painkiller. We have Dr. Shaji. And I think that we have another doctor also, Dr. Santosh. Let me see whether Dr. Santosh has joined. Okay, yeah, Dr. Santosh. And Gobomar. I'm sure that you must have heard the brand name. Brufen. Some of you might have heard. Yes? Yes. Shashimarji shaking, nodding. Aspirin. Long time back, it was aspirin. It was a painkiller. Then came paracetamol, which is called the crocin or Calpol. Then NSAIDs. Brufen, generic name is ibuprofen, then naproxen, many. Diclofenac. They are stronger painkillers and inflammation. So for knee pain, back pain, instead of prescribing paracetamol, even now, for back pain, most of them, they don't require the NSAIDs, but doctors prescribe NSAIDs. Then what happens? When the patient feels better, many people, they don't realize, ignorance, they don't realize how dangerous this medicine is. And especially in India, in USA also, these NSAIDs are available without any prescription. You don't need a prescription. So they go and buy Brufen from the medical store. They take the tablets. And what happens? Chronic use of, that is long-term use of NSAIDs can cause kidney failure. Now you see how many dialysis centers, 40 years back, did you see so many dialysis centers? Yes or no? If it is no, put N in the chat box. 40 years back, how many dialysis centers did you see? Now, how many dialysis centers are there? Roy Chiranji, no. Hundreds of dialysis centers. How come suddenly People are developing kidney failure. NSAIDs, misuse, overuse. Again, another real life story. My cousin, he was obese, and because of obesity, he had knee pain, and he was prescribed on NSAID. Then subsequently, he went to Dubai, and he lived in Dubai for a few years. And for the pain, he went to the medical shop there and continued eating the NSAID. Again, he developed kidney failure. Then he had to come back to India. Dialysis, hemodialysis. He lived on hemodialysis for the next 5 to 7 years. 3 times a week. Each session 3 to 4 hours. Very expensive. His whole freedom is gone. Ruined. He wouldn't leave that place. He stopped attending social functions. Dialysis. Tuesday, Thursday, Saturday. And he eventually died. I used to be in touch with him. I used to talk to him every week, Saturday or Sunday. So I know how much suffering he had. Is it a new information for you? If it's a new information, put new in the chat box. Is it a new information? Put NEW, new. Because I told you I want to, because that you must know, new, you must know. Nobody else is going to teach you or make you aware of this one. I happen to be one of the very few doctors who takes all efforts to empower, enlighten and empower the people to protect you from. Because of ignorance. You do this out of ignorance. And many people, because of the laziness to consult a doctor or going to a doctor or then again time, money, they consult who? Either Dr. Google or they go to a medical shop and the guy who is selling that one, 8th grade or 10th grade, fail. He will give proven. He knows it is a painkiller. Not only that, these NSAIDs, they act against the blood pressure medications. If a person has got high blood pressure, if he takes the Brufen or on a long term, the blood pressure control, it won't get better. Then the doctor will increase the dose of blood pressure medicine. And every medicine has got side effects. So now, side effects from the blood pressure medication and the side effects from the NSAIDs. ഒന്നല്ല, രണ്ടായി. Everything starts because of ignorance and self-medication. Is it clear? Very clear, put C in the chat box. And look at this one. It is a shame. This one, I communicated so many people. How many people have shown up for this session, live session? Only 19. People don't even realize what is important, what is necessary. They are busy watching some serial. I'm sure that they are not as busy like Modi or Trump. Most of them idle, sitting at the home, watching some serial. Stay ignorant. Am I right? If I'm right, put R in the chat box. It is not that I didn't reach out. They got the notification about this one. Thank you, Amandraji. That is the problem with the Prabuddha. Mandamari. Mandigal. പൊങ്ങച്ചം പറഞ്ഞിട്ട് നടക്കും. എന്നിട്ട് ഡയാലിസിസ് ചെന്നെത്തും. They will end up in some dialysis center. Okay. So 1 million plus hospitalizations worldwide. That is not a number in USA. Every year, 1 million means 10 lakh. CDC, that is Center for Disease Control in USA, puts a C. difficile, that is a bacteria. Clostridium difficile burden at 450,000 cases, 29,000 deaths. That was in 2015. Now it must be more. Have you heard about the C. difficile? If you have not heard, put N in the chat box. Then I will explain. Then I will make you aware. What exactly is this one? No, Roy Ranji, no. Yeah, Rajiji. No. But none if they have joined. Yes, you are right, Rajiji. I know. Musamilu, Rajiji. The C. difficile is a secondary infection inside the gut. Uparwala, God, to protect us, we have many good bacteria. Not all bacteria are bad. Inside the small intestine, large intestine, there are billions of bacteria to protect our health. And when somebody takes an antibiotic, the antibiotic kills this bacteria also, the healthy bacteria. So your immunity is gone. They are as soldiers. Those bacteria, they are as soldiers to protect you. And when this kills those bacteria, now the dangerous bacteria, when they come, there's no protection. They grow. C. difficile, common, this one is antibiotics. Misuse mostly. Or overuse. What antibiotic? Commonly used antibiotic, ampicillin, amoxicillin, cephalosporin. You will go for, cough, amoxicillin or ampicillin. Sore throat, amoxicillin, ampicillin. The C. difficile infection, diarrhea, fever and diarrhea. The number of diarrhea, mild or severe, 3 to 10. And after that, diarrhea, toxin, septicemia, sepsis, they die. It is very difficult to eradicate also. You have to give another antibiotic to treat the C. difficile, vancomycin. Oh, that itself is a very toxic. I have had the opportunity to take care of patients with the C. difficile, diarrhea in USA. In my own, I witnessed the death of some patients. Now these days, interesting treatment. You know, there is a fecal transplant, just like the kidney transplant. Shit. You give the shit of a person, a healthy person, and take his shit. And you, some kind of a blender, they mix it. And it becomes just like a, what you call, chocolate milkshake, chocolate milkshake. And they give it to the colonoscopy. Now it is available in the form of a capsule. So you don't have to even go through this one. You take that capsule, you are eating somebody else's, stools. Fecal transplant therapy. The point is, unnecessarily antibiotic misuse. Is it clear? Because many people, they don't even get diagnosed. In many hospitals, the doctors, they don't suspect this C. difficile. They don't suspect. They don't do the appropriate investigations to find out whether that person is suffering from C. diff. Die. Scary. Is it scary? If it is scary, put S in the chat box. Scary. What I have shared with you is scary. Yes, Rohit Karyanji. So never, 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 first and foremost thing, never go to any doctors for mild symptoms. I told you several times, sore throat, fever, more than 95%, they don't require any antibiotic. But if you go to your doctor, I told you the doctors are also ignorant about all these things, or they don't care. They prescribe antibiotic. For a fever, I told you. Several times I have told, I repeat again. Why I am repeating certain things? I should keep on repeating. Fever, wait for 2 or 3 days at home. Take rest. And if just tea, bread, light food, will go away. But all this prabuddha, prabuddha, they make a self-diagnosis. They worry. Is it dengue? Or is it chikungunya? Or COVID? Or monkey fever? Or Nipah? They immediately go to the hospital. And the hospitals, they love such patients because they can make money. How do they make money? Investigation, lab investigation, battery of investigations, 3,000 rupees or 4,000 rupees the whole day you spend in the hospital for results will be ready in the afternoon. And everything is normal. The doctor says everything, don't worry, you go and eat some kanji and all those things. Will you be happy? Will the patient be happy? No. I already spent 4,000 rupees and he's saying that go home and, or for a family, 3 members, 10,000 rupees. So the doctor writes an antibiotic. Believe me, doctor prescribe an antibiotic when it is not indicated. എന്ത് പറയും? പേടിക്കേണ്ട, പക്ഷേ വേറെ ഇൻഫെക്ഷൻ വരാതിരിക്കാനായിട്ട്. This is to prevent an infection. No, they give you a new disease now. You take that antibiotic, you subsequently develop C. diff this one or something else. This is a reality. Reality. You will rarely come across a person like me. And Hegde also, sometimes he talks about these things. Hegde, sometimes. But Hegde also, 50% he talks sense, 50% nonsense. I had the opportunity to listen to Dr. Hegde. Sense, nonsense. But I make sure that whatever I'm sharing is 100% sensible. Again, CDC, drug overdose deaths decreased in 2023. They are saying increase. I have highlighted that drug overdose deaths decreased overall from 111,000 to 107,000. Is it a small number? More than 1 lakh. More than 1 lakh drug overdose. What is happening? Drug overdose. The reason, do you know? Especially prabuddha. I am using the word prabuddha because I'm really angry. People are boasting there. Malayalam Manorama, Madhuri, prabuddha Kerala, Mannangata, prabuddha Kerala. Pongacham, പറഞ്ഞുകൊണ്ട് നടക്കുകയാണ്. They won't consult one doctor. Now it is a very common tendency to consult 2 or 3 doctors. Am I right? If I am right, put R in the chat box. For the knee pain, they go to a rheumatologist or orthopedician. For stomach, this one, gastroenterologist. Am I right? They go to, yes, thank you, go to more than one doctor. Then what happens? Rheumatologist, he may prescribe one NSAID, a brand name, different brand name. Subsequently, he goes to another doctor. He also may prescribe the NSAID, but it is a totally different brand name. You don't know that you are taking the same medication. Now there is overdose. Is it clear? If it is clear, put C in the chat box. You know, you can see my tone. I'm really actually upset. Now overdose, the patient is not realizing there's overdose. Kidney failure guaranteed. You're taking excess dose. Two different doctors, two different brand names. Very common. The medical establishment has become the major threat to health. Austrian priest and philosopher. We have a father here in this session, Father Suresh Kumar Nelson. He has joined from Kansas. Major threat to health, especially the corporate hospitals. Crores of rupees they have spent, invested. They want to recover. What do? All unnecessary investigations, the CT scan, radiation from a CT scan is equivalent to a radiation a body gets from taking 100 to 200 X-ray, chest X-ray. Radiation is harmful to the health. So one CT scan, how many people are aware? They don't. You ask a doctor, many doctors are also not aware. I'm not kidding. Many doctors are not aware of the fact that one CT scan, the radiation, 100 to 200 times. And radiation induces health problems. Interesting. Earlier the participant number went crossed 20, now it has come down. Because some Prabuddha people, they thought, okay, yeah, this konda, this vanda. Poirikkan avade. Valla serial കാണാനായിട്ട്. വല്ല ജിലേബിയും കഴിച്ചുകൊണ്ട്. Doctors will have more lives to answer for in the next world than even we generals. When did he say? 300 years back. He was talking about 300 years back, Napoleon. At that time itself. Is there a problem now? How much? Killers. Watch that video, Dangerous Doctors. You must have seen the tagline of James Bond movie. James Bond 007, 007, license to kill. He says, license to kill. Most of these doctors are James Bonds. They have the license to kill. That's what. So you are going to a James Bond. If you go to a corporate hospital, and if that doctor is most of the time below the age of 40, yes, he is a James Bond. Okay, he will kill. Kill means he may ruin your health, disability, or he may just mayatak. My own father, insulin, unnecessarily insulin was prescribed for my father. He had a very mild diabetes and a big dose. It would have killed him or death or disability, guaranteed. My doctor in USA, when I went, I said, no, don't. And that too, insulin pen, because why pen? They get more money from the pharma industry. The insulin pen. And my nephew bought that one. I told him, no, he doesn't. And he wouldn't believe me, he wouldn't trust me because I'm his uncle. Muttatte mullekku manamilla. And he said the prescription was given by an endocrinologist. He should be called not endocrinologist, endocriminologist. He prescribed that one. 10 units. I told him, no. Oh, illa mama, vaangichadu. Itrayum vela. You have spent this much money. And I told him, okay. 10 units, don't give 10 units. 6 units, and then ask the nurse. Near my house, there is a Valtala nursing home. A nurse or somebody in the morning come and check the blood sugar and see the reading. The next day when the blood sugar checked, it was 70 milligrams, it was low. If he had received 10 units, it might have gone below 50. Below 50 can kill or can cause coma. Then I told him, reduce it to 3 units. On the next day, it was 84. I asked him to stop. So if I didn't intervene, that is my father, that endocrinologist, by prescribing that medicine, he would have killed my father. Am I clear? Is it crystal clear? Put CC. That is why this topic, I am very, very much. You can see my emotion, how much that is. I'm vocal. Because I'm trying to enlighten and save people. That's all. Thank you, Rajiji. Medicine sometimes snatches away health and sometimes gives it. Ovid. When? Before Christ. More than 2000 years old. So this is a problem, my dear friends. This is a problem. Even then. Now it is worse. If it was bad, it is worse. And it is becoming worst. Be careful. 6 categories of killer drugs. Antibiotic misuse, I told you. Painkiller misuse, I told you. Vitamins, yeah. This again, many people don't realize that vitamins are not safe. Vitamin overdose creates many health problems. Just to check one, because we don't have that much time. I gave a talk, hypervitaminosis. It may be there in the YouTube. Vitamin A, excess dose, can create headache, bone pain. So if you take vitamin A unnecessarily from the medical store or some doctor prescribes, many doctors are also ignorant, I told you. Don't think that doctors are all intelligent. There are plenty of ignorant doctors and who have got IAS syndrome. IAS means ignorant, arrogant, and stupid. Doctors are also there. So vitamin A toxicity, headache, then they may go to Dr. Shaji, neurologist. I am having headache. Dr. Shaji is a busy practitioner. He used to see when he was practicing long time back up to 60 to 80 patients every day. He won't have the time to go into the details to get a history. His time is a resource. He may order a CT scan to find out, to rule out anything serious. CT scan, normal. Because vitamin A toxicity, headache, CT scan will be normal. He may give some painkiller. The headache, will it go away? No. It may get controlled because of the painkiller. You stop, again the headache comes back. Because he didn't stop the vitamin A. That is, the vitamin A is causing that headache. Is it something really new information? If it is a new, put in new information. And many people, they don't know. They think that vitamins are good for health. Yeah, more vitamins, more health. No. Thank you. So vitamin overdose also. Not only there in USA, also self-medication. If I go to all these the big grocery stores, numerous different brands of vitamins. Vitamin A, vitamin B, vitamin C, 1000 milligram. Like, eat more vitamin C. Yeah. Vitamin C is a water-soluble vitamin. The body cannot retain. If you eat more, next day in the urine, that will get excreted. You are spending money and buying something so that you can pass it in the urine. Eat healthy food, many fruits. Nellikka madi vitamin C, 1 nellikka. Very cheap. That also you don't have to eat it. Naringa vellam, lime juice, small orange, vitamin C. I don't take any vitamins except vitamin D because in sunlight I am not able to get the sunlight here because winter most of the time. Vitamin D is synthesized in the body. Even though I drink milk and other items, still vitamin D. So I'm taking only vitamin D, nothing else. Vitamin A is a fat-soluble vitamin. Papaya, mango, and during a season, if you eat a mango for 2 or 3 months, the excess will be stored in the liver. It is a fat-soluble vitamin. You don't need it for the rest of the year. Then why the hell are people taking the vitamin A? Carrots, vitamin A. Diabetes medications, I told you. My own father was about to be killed. Blood pressure medications, yes. The pharma industry and the doctors, they come out with the new guidelines. In the past, when I was doing my MBBS days, if a person is above the age of 60, yes, systolic blood pressure, if it is 150, 160, you don't have to worry, you don't have to treat. Now, even if the patient is 80, yeah, keep the blood pressure below 130. Why? So that the pharma industry, they can sell more medicine. So more medication, the blood pumping, the heart needs enough pressure to pump the blood. And when it pumps, it reaches the brain to different small hairline, thick, tiny vessels. And when it doesn't reach, people may develop dizziness, memory loss, new health problems because of the tight control of blood pressure. When I came back again, in 2009, when I came to India, I saw my father was taking 3 different blood pressure medications, and he was feeling a bit dizzy, tired. I stopped 2 medications right away. The other one I increased slight dose. And I kept his blood pressure between 140 and 150 most of the time. Otherwise, it was very tight control. It was around 120. And he lived for another 10 years. No problem. So they killed. Tragedy again, some more, 2 more Prabhuza, they have left. Now it is 15. They are not interested. They want to die from medication. This doctor is making me leave. No. ഞാൻ പ്രബുദ്ധയാണ്. So, and lastly, cholesterol medication these days. Cholesterol, statin. That again, the pharma industry conspiracy. 30 years back, the number was, okay, if it is a 150 LDL above, yeah, you need to take. Then they reduced to 130. Because just like the income tax also. If the government wants more money, suppose the income tax, that ceiling is, suppose previously it used to be 5 lakhs. They say 3 lakhs and above you have to pay income tax. More number of people will have to pay. If it reduces to 2 lakhs, still millions of people. The same way from 150 to 130, yeah, now millions of people, yeah, they will have to take the medication. From 130 to 100, yeah, another more. Then the cardiologists, they are so aggressive, 70 milligrams. Take the medication. And my dear friends, statins, the so-called statins, they can cause the blood pressure, they go up, the new diabetes. If you didn't have diabetes, some patients, they develop diabetes because of the cholesterol medications. They already have diabetes that can make the diabetes control worse. Did you know this one? If you didn't know, put N in the chat box. N in the chat box. Because many doctors, even the cardiologists, they are ignorant about this fact. And our Dr. Surendran is here. He was taking a very big dose of the cholesterol medicine. I asked him to reduce, and he's taking a very low dose. I asked him to stop, but he's not prepared to stop. He is worried. Okay. So, Surendranji, am I right? That is an overdose. statin medications. The person who takes medicine must recover twice. Once from the disease and second time from the medicine. Health problem, you have to recover from your disease and then the side effects of the medicine. Sir William Osler, the father of modern medicine. One of the first duties of the physician is to educate the masses not to take medicine. Doctor, he was very sensible. Sir William Osler, there are plenty of quotations. He was a great clinician. I follow his advice. As a medical doctor, even now, what am I doing? That's what I'm doing. To advise people not to take medicines. Not to take medicines. That's what I'm doing. The best doctor gives the least medicine. Benjamin Franklin. Very few medicines. But I have seen, because when I get a new patient here, they come with a list of medication they are taking. Up to 25 medicines. Some patients with 25 medicines. I'm not exaggerating. Again, duplicate also. I told you, drug overdose. Then I sit and analyze and they say, okay, you don't need some 8 or 10 right away. Nearly more than 50% of the patients, they listen to me. But 50% again, no. I have been taking it for no, doctor, don't stop. Don't stop. Okay, it is their choice. So polypharmacy, very common health problem. First, to modify the patient's diet and lifestyle, and only then, these do not affect a cure, treat with medicinals and acupuncture. Diet and lifestyle modification. First, Adrian the Emperor exclaimed incessantly when dying that the crowd of physicians had killed him. Too many doctors, too many specialists. You must have heard the expression, too many cooks spoil the broth. Roy MCG, have you heard that expression? Too many cooks spoil the broth. Too many physicians, same danger. And according to one of the write-ups, Alexander the Great, he died when he was hardly 33 years old. And he told, I am dying with the help of too many physicians. I am dying with the help of, because he was an emperor. So there are plenty of doctors around him. I am dying with the help of too many physicians. Don't go. Take home message, choose one doctor. A general medicine doctor, a MD qualification. Then let that doctor decide. And make sure that doctor is not working in a corporate hospital. If he is working in a corporate hospital, okay, he will refer it to cardiologist. He will refer it to neurologist. That is how they generate money. Independently, solo practice, or his own small clinic, chota clinic, go and see the doctor. General medicine. Medical science is making such remarkable progress that soon none of us will be well. Yeah, now, previously there used to be diabetes. Now they are coming with the pre-diabetes. Yeah, if the number is below this one, now you have pre-diabetes. Previously hypertension, now pre-hypertension. Yeah, you are a sick person. If you are not hypertensive, you are pre-hypertensive. If you are not a diabetic, you are a pre-diabetic. And the other day, while I was driving, the radio station said that, okay, pre-diabetes screening. Okay, now they have started now. Pre-diabetes screening. And you lose all your peace of mind. You'll be given a label. You're not healthy. Don't forget to share this video with your friends and family. If they are not Prabuddha, then they will watch. If they are Prabuddha, then they won't watch. Sometimes some of them may not be Prabuddha. Some of them, they could not come because of some other commitment. Some research. I know there is some people. they watch my videos and they contact and they, doctor, and they put in the comments also. That means some people, they do watch. So share it with your friends and family. Upcoming talks, energy drainers and energy boosters. But energy illa. I'm so tired. Energy illa. Roy MCG, am I right? Low energy. That is what next week. Energy drainers, energy boosters. Then dangerous people. Same Zoom link. Okay, now we have 3 minutes left. If you want to ask any question, ask this question. Then after 9 o'clock, we'll continue the discussion. Then I'll be able to share more information. Any questions? Did you find this session really eye-opening? Is it an eye-opening talk session? If it is eye-opening, put EO in the chat box. Is it an eye-opening? Yes, Roger Auntie. Okay, thank you, Ajiji. Any questions? Nobody, you will never get this kind of a talk from anybody else. That I am so confident. Get the corporate sector doctors, they wouldn't want to talk about it. They wouldn't want to. Because all along, it is not that, oh, you are retired, that is why you are talking about like it. No. When I was in the medical college service also, I didn't engage in private practice. I never indulged in any kind of unethical practice. Here also, no. I walk the talk. I practice what I preach. That is the... Any questions? Why are you so timid? Roy MCG, do you want to say something or ask something? Sajimarji. Only 8 people died in that Kashmir terror attack, but every day thousands of people are dying because of the medicines. Thousands. So when compared to 28, thousands daily. Okay, Gopal wants to say something, and I'm going to stop the recording. Then,
and as I thought that I will ask after that.
No, let me stop the recording first. Then we will.
Okay.
Okay. Don't forget to share this video, forward this video with your friends and family members.